For thousands of years, humans have used hallucinogens for ceremonial, spiritual, and recreational purposes. However, it was only in recent years that psychedelics have come to the forefront of modern medicine. Today, I'll be presenting about the use of MDMA, ketamine, psilocybin, and LSD in treating various mental health issues. In contrast to most psychopharmacological treatment models, the psychedelic treatment model aims to treat psychological disorders through transformative psychological experiences by administering psychedelics to patients within a small number of sessions. Hallucinogenic drugs are classified into two groups: classic hallucinogens and dissociative anesthetics. Classic hallucinogens produce pharmacological effects by interacting with the 5-HT system. Specifically, they are agonists of the serotonin 2A receptor, or 5-HT2A receptor, which Julianne has previously introduced. In contrast, dissociative anesthetics interact with the glutamatergic system and do not produce a trip as do classic hallucinogens. MDMA is a classic hallucinogen that primarily releases serotonin, dopamine, and norepinephrine. The release of these neurotransmitters is made possible through the reversal of transporter proteins and reuptake inhibition. MDMA also triggers the release of hormones such as cortisol, oxytocin, and vasopressin. Since MDMA only produces mild cognitive and sensory alterations, it does not cloud consciousness, and patients often retain a clear memory of the sessions. The interaction of these neurotransmitters and hormones elicits feelings of trust, openness, and social connection, all of which can strengthen the therapeutic alliance. Furthermore, other studies have also shown that MDMA administration may enhance introspection, which is the act of looking inward to observe one's own psychological processes. One potential issue of having participants practice introspection is that introspection is very much subjective and therefore unreliable. It requires the participants to be intelligent and articulate, which is not always the case. From a more neurobiological perspective, MDMA attenuates the effects of the amygdala and stimulates the frontal cortex. The frontal cortex is often less active in patients with PTSD. Hence, stimulation of the prefrontal cortex, a brain region crucial to the production and regulation of emotions, could reduce symptoms of PTSD. MDMA also increases the release of oxytocin, a hormone essential to pair bonding and social behaviors, which elicits feelings of interpersonal trust. Moreover, mouse experiments have revealed MDMA's ability to disrupt fear memories by releasing serotonin in the basolateral amygdala. MDMA is also thought to induce memory reconsolidation and promote fear extinction through the release of monoamines, which can help PTSD patients process traumatic memories. Memory reconsolidation is the process of modifying or updating existing memories. Whether memory reconsolidation is a permanent solution should continue to be investigated. There is the possibility that previously reconsolidated memories could be reconsolidated a second time and become traumatic to the patient again. However, it is important to note that the use of MDMA in psychotherapy comes with side effects that include headache, nausea, and teeth grinding. Ketamine is a dissociative anesthetic that acts on the glutamate system and is often used to treat disorders such as depression and PTSD. Ketamine is used to treat depression because its interactions with glutamatergic signaling pathways produce rapid antidepressant effects. Ketamine's interaction with the glutamate system affects memory reconsolidation and extinction learning. Since unpleasant memories play a crucial role in maintaining depression, memory reconsolidation may improve depression symptoms by reducing the emotional burden of specific memories. In addition to treating people with depression, ketamine is also used to treat PTSD, a synaptic disconnection syndrome, by increasing synaptic and neuronal plasticity at a rapid rate. This enhanced plasticity may also increase patients' receptiveness to psychotherapy. In anorexia nervosa, changes in the dopaminergic reward system may result in failure to discriminate between reward and punishment. There is evidence that ketamine can regulate the brain circuitry associated with reward and motivation by increasing synaptic plasticity. In terms of its neurobiology, ketamine acts as an antagonist to a glutamate receptor called the NMDA receptor and also activates the protein complex mTORC1. mTORC1 is involved in a wide range of neuronal processes and, most importantly, protein translation. The translation of mRNA in dendrites produces proteins that affect synaptic function and plasticity and, in turn, allows the brain to adapt to future-related stimuli. This evidence strengthens the argument that ketamine can treat depression by implying that synaptic plasticity may counteract the loss of synapses caused by chronic stress and depression. In one study, a group of adolescents with treatment-resistant depression, or TRD, were administered one dose of ketamine. The control group was given a psychoactive placebo called midazolam. The researchers found that ketamine had a rapid effect on reducing depressive symptoms, with symptoms improving after only 24 hours. However, although the study stated that the adolescents remained on their own medication, the researchers failed to mention the possibility that the ketamine interacted with their medication. This graph depicts the average MADRS scores of adolescents given ketamine or midazolam over the span of 14 days. You can see that there is a significant drop in the MADRS score of participants given ketamine 24 hours post-treatment. However, ketamine does have high abuse liability, and its long-term use can lead to high levels of toxicity in the bladder and nervous system. Psilocybin is a classic hallucinogen that increases dopamine release in the brain through its interaction with 5-HT2A receptors. Regarding its neurobiological mechanisms, psilocybin is an agonist of the 5-HT2A receptor. Furthermore, the default mode network, or DMN, is a group of brain regions most active when the brain is in a resting state. Psilocybin reduces blood flow to the DMN and causes changes in the functional connectivity of the DMN's networks, which in turn may alter an individual's perception and re-evaluations of events and people. In one experiment, 20 individuals with TRD were administered psilocybin in 2 sessions. Then, fearful, happy, and neutral faces were presented to the individuals while the researchers observed their amygdala activity. The amygdala is a structure in the limbic system responsible for processing emotions such as fear and aggression. 1 week after treatment, the researchers observed an increase in amygdala responsiveness to fearful faces. In general, the participants were more responsive and accepting towards all emotions, even negative ones. This finding is in stark contrast to the findings of experiments using SSRIs, where a decrease in amygdala response was observed in participants. Thus, it is suggested that psilocybin may be more effective in treating mood disorders than traditional SSRIs by allowing patients to confront their emotions. In this figure, you can see that there is an increase in responsiveness not only in the amygdala, but also in other visual areas of the brain. One limitation of the study is that there was no mention of whether the researchers ensured that the faces presented to the participants were consistent with the universal facial expressions. If the participants came from varying backgrounds, they could have associated the faces with different emotions, which would have affected the results of the experiment. LSD is a classic hallucinogen, similar to psilocybin, that increases an individual's sensory perception and puts them in a dreamlike state. LSD broadens the scope of an individual's thoughts, allowing their brain to make new associations and altering their perception of objects and relationships. This suggests that LSD can be used to treat different disorders by allowing patients to create more positive associations and see things from a new perspective. Additionally, LSD also reveals the latent psychodynamics of an individual, providing access to the thoughts, feelings, and other inner processes hidden in their unconscious. This seems to be connected to psychoanalytic therapy, a type of talk therapy rooted in Sigmund Freud's theories that explores how an individual's unconscious mind influences their thoughts and behaviors. Perhaps this has implications for future research to focus more on how psychedelics may enhance traditional forms of therapy, rather than on psychedelic therapy as its own category. From a more neurobiological standpoint, LSD acts as an agonist of the 5-HT2A receptor. In one study, rodents were administered LSD and then exposed to stressful conditions. The researchers found that LSD prevented stress-induced changes both behaviorally and neurologically. What's more, LSD increased the density of dendritic spines in the rodents, which increased the transmission of electrical signals between neurons. In conclusion, the study presented evidence that LSD may be useful in treating anxiety disorders by repairing the dendritic spines that are damaged due to stress. This figure illustrates that repeatedly administering LSD to stressed rodents prevents further neuronal impairment. Specifically in Figure 5C, you can see that LSD treatment caused the firing rate of 5-HT neurons in stressed rodents to increase to a rate comparable to that of non-stressed rodents. Finally, in terms of side effects, the intensified thoughts and emotions that come with LSD might make it more difficult for individuals to cope with challenging situations. Furthermore, participants of LSD experiments have reported experiencing mild irritation in the days following the sessions.